welcome to the Medline Short Case series. In today's video, we are focusing on sore throat. So, what is a sore throat? We've all seen this or we've had these symptoms before. And notice I mentioned the word symptom. A sore throat is a symptom, it is not a disease. There are many causes of a sore throat. For example, GORD. Okay, you know when you get indigestion, when you've had too much to eat at night, that can cause GORD. Also, it can be caused by oral infections such as candida. Okay, it can be also caused by medication, can be caused by tonsillitis and infectious monoclonus. So, moving on next to the anatomy, in order for you to be able to safely treat this, it's very important that you understand the human body. And remember, everything is connected. Your mouth, your throat and the lungs are, they're all one, they're connected. So there is a chance that you could have an oral infection and that could then trickle its way down to the lungs and cause possibly even a pneumonia. So just keep that in mind. Now, regarding the oral cavity, what is the oral cavity? It's the mouth. Inside, that's what we call the oral cavity. What I want you to focus on then, the oral cavity, is three major structures. We've got the hard palate and the soft palate. Now, how you find the hard palate and soft palate is pretty straightforward. I want you to get your tongue. I want you to feel the roof of the mouth as you start to move towards the teeth. It's got a hard texture, that's the hard palate. As you start to move backwards, we have the soft palate. Straightforward, right? Then I want you to focus on the uvula. So the uvula is that dangly part that you see that just hangs in the center. Not really sure what the function is, but it's there. I also need to focus on the tonsils, mainly the palatine tonsils. Now, lymph nodes. Put a big cross against glands. These are nodes, and these nodes play a role in immunity, and these nodes can become tender if you have an infection and inflammation. Now, I want you to remember something. Infection and inflammation are not synonymous. Just remember that. They're separate terms. Right, what are the causes of a sore throat? So the common cause of a sore throat is viruses and upper respiratory viruses, such as the coronavirus, parainfluenza virus, influenza and so forth. You can get also other viruses such as EBV, Epstein-Barr virus, but we're going to park that aside and we'll do a different video on that discussing Epstein-Barr virus versus streptococcal pyogenes infection. So we've got viruses and we have a bacteria. A particular bacteria that you've all heard of is Streptococcus pyogenes. So we know what a sore throat is. We know what the relevant anatomy that we're going to be focusing on. We know the causes, the major causes. Let's move on to signs and symptoms. So patients with a sore throat can present with various other signs and symptoms such as fever, pain on swallowing. They could also have tender lymph nodes. They could also feel a bit nauseous, can have actually, a bit of abdominal cramps and upset tummy as well. So there's many different symptoms that people can present with. Now, for you, how do you reach a diagnosis of a bacterial sore throat versus a viral sore throat? Pretty straightforward actually. If you have a patient who has a cough and has causal symptoms such as runny nose, blocked up nose, and has a sore throat, it's most likely going to be viral. Bacterial sore throats, on the other hand, we can use what the NHS has devised for us, the fever pain score. So the fever pain score tells you that these people will present with fever. They're also going to have pus or purulence on the tonsils. There's going to be absence of cough. There's going to be inflamed tonsils, and they would have attended to you within 3 days of onset of the symptoms. Or you could say within 2 days of the onset of the symptoms. So the fever pain score is very useful for you to make a clinical decision making on a bacterial sore throat versus a viral sore throat. Again, the key is going to be fever, the key is going to be absence of a cough, pus, and they normally attend to you within 2 to 3 days. So with that in mind, what would you find on an examination? So on examination, these individuals might have swollen tonsils, there may be pus, they may also be inflamed uvula. In addition to that, they might actually have a bit of a tummy ache and generalized malaise. But they could also be signs of EBV. So you've got to be a bit careful with that. Now, moving towards the treatment, how do you treat someone who may be having a sore throat? First is over-the-counter remedies and self-help. Paracetamol where appropriate and ibuprofen where appropriate. Some people may also benefit with gargling salt water. They may also benefit from actually putting ice cubes on the tongue. I'm not sure how beneficial that is, but some people do benefit with that. Treatment-wise, if it's indicated, to issue a prescription for antibiotics. For example, if the fever pain score is 4 out of 5, you can give phenoxymethylpenicillin. 2 tablets 4 times a day, normally for 10 days. If they're allergic to penicillin, you can issue clithromycin. And if they are pregnant, then you might want to consider erythromycin. So that's the treatment. In terms of alarm features, I want you to focus on this. Patients who have drooling, have stridor, have signs and symptoms of epiglottitis, do not examine the mouth if they have epiglottitis, have a muffled voice if the uvula is deviated, or have abdominal pain, have any sort of lesions in the mouth. You want to be careful because there could be a serious infection or it could be EBV. I hope you find the video useful. Subscribe to my channel and visit www.medland.co.uk for further content. Thank you for watching.